Welcome to From the Frontline with Ed Kelly. I'm your host, Ed Kelly. We discuss both global health and biopharma topics here on our podcast. Today, we're excited to have Heidi Larson, founding director of the Vaccine Confidence Project. She's also headed global immunization communication at UNICEF. She's an author recognized as one of BBC's 100 Women of 2021, and she's also a senior advisor to ApiChecked. In this episode, my colleague Dr. Paul Rutter sits down for a chat.
Today, we're very excited to have Dr. Heidi Larson with us, a pivotal leader in global health. Heidi, why don't you tell us a bit about yourself?
Good morning, Paul. Nice to see you. I'm Heidi Larson. I'm a professor of anthropology and risk and decision science, which is a bit of a different angle on anthropology, but looking at all kinds of how behavior and risk perceptions affect people's willingness to take a vaccine or other health interventions. I am also the founding director of the Vaccine Confidence Project, which I founded in 2010, basically after years in UNICEF and working in the field around immunization, which you know well. So I really did see a lot of issues around it wasn't so straightforward to just make a great vaccine, get it safety approval, and get it to people, that there were bumps in the road that we tended to pay attention to too late in the game. So Vaccine Confidence Project is trying to anticipate where we need some confidence building before. And that's where I've landed. I've been doing much more in the context of COVID, expanding beyond vaccines and looking at what are all the things that facilitate cooperation.
Thank you so much for joining us, Heidi. Let's jump into vaccine confidence. Can you define vaccine confidence for our listeners?
I guess the briefest version is, what are the factors outside of when you have access and supply and good vaccines and approved, and people still don't want them? Why are they hesitating? Why are they wobbling? We developed a vaccine confidence index, a little bit like the consumer confidence index, from 0 to 100%. And one of the big things we learned about public confidence in vaccines is it's very volatile. You can't measure it in January of 2020 and expect it to be the same in 2023. Confidence was more stable low or stable high 10, 20 years ago. So it's even more important to monitor it. But confidence is like trust, confidence that it's going to work, that it's effective, confidence that the reason people are giving it to you is in your best interest and not in their financial motive, and confidence that it's going to make a difference in your life.
And I know that your work involves identifying those trends and then also working with country partners to try to build or rebuild trust where there is low confidence. In the confidence itself, or in how you work to build confidence, what are some of the differences that you see across different countries, different settings?
Well, interestingly, one of the things we've learned in 13 years of the Vaccine Confidence Project, and I saw signs of this during UNICEF, but I didn't see it in such a systematic way now that we have metrics and are monitoring globally, that sometimes, frankly, it's 70 to 80% of people, their confidence is not about the vaccine or lack of confidence. It's about the system. It's about they don't trust the system, or they had a bad experience at the healthcare center and they weren't treated nicely, so they don't want to go back there. Or we talk about confidence in the product, in the provider, and in the policies. Because when it comes to policies, well, that includes issues like mandates. Why are they forcing this on me? As the perception sometimes. Mandates are rarely, but importantly used. So that's one kind of policy. But the other aspect of policy that affects people's confidence is it fair? Is it prioritizing just certain parts of the population and neglecting others? Who's getting it first? Those kinds of fairness things really weigh into people's sense of confidence in the motive of the provider.
So interesting. As you look across the world, do you see patterns geographically that are easy to describe and some insights that you can summarize, or is everything so context specific that that's hard to do at a summary level?
Well, I have to say, in our vaccine confidence index, we have four key component questions, and one is confidence in the importance of vaccines. Do they matter? Are they important? One is confidence in safety. One is confidence in effectiveness. Do they work? And the fourth one that we added, because we saw it did have stronger influence in some places than others, but is it compatible with your religious or other beliefs? As you know, in the US, even that became more and more of an issue. In fact, there were people lobbying to change it from religious to philosophical beliefs, which was a bit broad. And we came to those four questions because they were kind of the most universal. We ran lots and lots of other questions to find out, well, what were the real predictors or levers of people's acceptance? So, perceived importance, perceived safety, perceived effectiveness, and compatibility with beliefs. Importance is generally the highest of those globally, although in a surprising to us meaning my research group, my lab, was that the COVID experience knocked confidence in the importance of vaccines, importance of childhood vaccines, when it really dropped, which was a bit shocking because we've seen ups and downs around safety and perceived effectiveness. Even compatibility with beliefs goes up and down sometimes for various reasons. So, those I would say as universal themes are there. The biggest predictor of acceptance is perceived importance. Because if you don't think a vaccine's important, you don't go on to care about its safety or effectiveness. Frankly, what I love about Abject is it really weighs into perceived safety. And that's a big area which I got more and more involved in, particularly in my work with UNICEF. But I see how strong of a lever it is. Once people agree with vaccines and think they're important, that's definitely the next big issue.
That's fascinating what you said, that perceived importance, which is the single most important area of the four, been adversely affected by COVID. Can you say more on that, and that, to the extent it's possible, what why is that?
And this is published in a whole chapter in the UNICEF State of the World Children Report this year, because the theme every year it's a different theme. And this year the theme is vaccines. So they contacted me and said, we really need to include a chapter on confidence. And we published, because we've been monitoring for years before COVID, we had comparators. And so we did compare 2022 with pre COVID metrics. Why did perceived importance of childhood vaccines drop? My view is that in the monitoring we've been doing before, the circles, both in terms of social media as well as these nationally representative samples, we have all the age and demographics in there. It was largely parents and maybe adolescent girls related to HPV or pregnant women who are considering vaccines, and sometimes elderly, around not elderly, older adults considering shingles, but in general, the kind of questioning population was more around childhood vaccines. What happened in COVID is that there's quite a few people who don't really think about vaccines in the course of their day. They go to work, they do their thing. They probably don't have kids at home, or if they do, they're past the baby age, so to speak. So they would have normally said, yeah, vaccines are important, safe enough. But with COVID, everybody was going online looking for information on vaccines. And my view is, even though I don't have robust evidence behind it, but pretty good sense of what the field's about, that there was a whole part of the population that had no clue how toxic parts of the information are, how critical and questioning, particularly the social media space, has become around vaccines. They've become highly political. They've been used as kind of a lever to express other grievances because they're population wide. So all these people that, just took vaccines for granted all of a sudden were confronted with questions they hadn't really thought about. Do you really know what's in a vaccine? Is one of the more provocative ones from the anti people. So I think it really shook the world in a sense, and we have a lot more questioning people, and they're not necessarily outright refusers, but there's a lot more questions in the broader population that we can't think this is going to just bounce back. We've got to deal with it. Some of it will come back because there was an overall issues that some people had with the way COVID vaccine was rolled out, and they are taking that kind of angst out on vaccines in general, but it's not going to all bounce back easy.
Fascinating and somewhat scary and intimidating.
Yeah.
In a moment, I'll ask you about the way forward, but let me just continue to ask you to look backwards. Obviously, the COVID pandemic has had a particular effect, but beyond that, as you look back over time, what has changed over the years? And is it right to say that mistrust used to be about more specific issues and is now more widespread? How would you describe the way that vaccine confidence has changed over the years?
It's changed pretty radically. I mean, the whole area of vaccine questioning is not new to vaccines, but it was, well, the very first organized vaccine resistance movement, if you can call it that, was in the 1800s around the smallpox vaccine. But it didn't get organized around just, some of the concerns of, oh, that's not natural, that's not God's way, because it was a pretty crude administration for the smallpox vaccine. He's scratching the skin and putting the pus of cow's pox. I mean, I can understand people hesitating a little bit, but in the face of a pretty fatal and debilitating epidemic, people will take risks. Where it triggered into a movement was when the UK government put a mandate on it. You have to take this vaccine. And when they lowered the age, it became even more organized. And that triggered the US and then other, or New England at the time, as it were, and some parts of Europe also started to organize these movements. But they were very, targeted small groups with issues, particularly libertarians. And over the years, there have been specific incidents that, particularly around safety, that have sparked mandates, and safety have been the kind of sparks that organize things. But they've been pretty either vaccine specific or event specific, and in certain circles. What's happened, particularly since, I mean, Andrew Wakefield and his suggestion that the MMR vaccine had some links to autism, that was in 1998. Now, that paper would have slept and we wouldn't have known about it pretty much if it had come out, I think, 10 years before. Because his paper, which only had 12 children, was later debunked, and his name was, taken off the General Register of medical doctors. So 10 years before, it wouldn't have gotten out there so much because his paper, coincidentally, was published the same year that Google opened their doors. He got lucky in terms of his advocacy because it was the beginning of an era of, and that was 1998. Facebook was only in 2006. I think people forget how relatively recently, and now we're in a whole different league. So I think the whole technology and communication environment has been a big thing, but we shouldn't also ignore that we have a lot more vaccines. Our communication and engagement with the public has not kept up at all with the pace of new vaccines, new technologies. We did a big campaign in the 80s to go from 20 to 70, 80% coverage around the world. Kind of took it for granted that, okay, they're in, and added more and more and more and more. So I think communication environment, a lot more vaccines, a much more litigious public for other reasons besides vaccines. I think those are the three big ones.
Looking forward, what steps would you take towards creating the perfect world if there were no limitations?
Well, I wish it were a vaccine that could fix the state of the world right now. But having said that, though, I remember when I was in UNICEF, and still in some cases, since I've been back in academia, I've seen places that actually vaccines and health in general can be a peacemaker. In principle, it should be apolitical. In principle, it should be neutral. And then there have been cases where warring sides have put down their guns for a day or two to let kids get vaccinated. In a perfect world, I'd love to see that happening. I wish health and particularly vaccines happen to be population wide, depending on the specific vaccine or other health measures. I mean, getting safe water to people. I wish that that could help the state of the world right now, frankly, along with health. But I think one thing we can't do is think we can move ahead with vaccines or other health things without taking into context the state of what's happening around it. We've seen that loud and clear in multiple countries during COVID.
That brings us to the end of the episode. Thank you so much, Heidi.
Nice to see you. It's a crazy world. So let's keep doing what we can to keep it on track in a good way.
Thank you so much for joining us.
A big thank you to Heidi Larson for joining us, and to Paul Rutter for chairing this discussion. For more information about these topics we've been talking about today on innovation in global health, I really encourage listeners to check out the websites to some of the organizations we've talked about, and we hope that this discussion was beneficial to you. To learn more about From the Frontline with Ed Kelly, please visit our website at apiject.com. Our next episode will feature a discussion with Carlos Fabrega from our partner organization HIPRA on the topics of One Health, the intersection of animal and human health, and how those topics will shape the future of vaccines and pandemics. This podcast is a product of Apiject Systems. As always, thanks for listening to From the Frontline with Ed Kelly. From the Frontline is produced by Kate Scott with lead writer Charlotte Mackay.
The views, thoughts, and opinions expressed in the podcast belong solely to the speaker and do not necessarily reflect the views, thoughts, and opinions of the host, sponsor, speaker's employer, or any other organization or individual mentioned.